I'd just like to make a couple of points. First one is some of my most successful colleagues, I actually think, get a lot of their reward and recharging of their batteries actually from their patients themselves, and I think that's something that we need to be mindful of in our day-to-day practice, is how do you actually make sure that you gain the support and positive feedback from the people who we care for. Some of my most admired colleagues in actual fact love going to work because actually they talk about treating their friends, you know, not they don't go out on the weekend with them, but they think of them as their friends and people who they've grown to know and like.
I'm just going to interrupt you there. Did anybody here go to the film yesterday, the movie that was shown by the Swiss? Yes. It was had a very high impact, and it was that very point. There were two doctors in the film, a young doctor who was so enthusiastic and had a special gift with people, I would think, but was obviously getting complete satisfaction from her own interaction with the patients. And we had an older doctor who disclosed that a number of years ago he was on the edge of burnout, and he paused and there was silence on the film for quite a while. He was very emotional. And then when he learned to put some balance into his life, he has now managed to continue to work for another 20 years, which he didn't expect to do when he was at a very low ebb. So it was very interesting. Yes, we can get satisfaction from our patients if we get the balance right.
And then the second thing I was going to go on to say was, you know, quite a lot of the discussion, if I put it into a medical term, is talking about the afterload, which is once we've got stress, how do we deal with it? And one of the other things that I think it's worthwhile talking about here is the preload, which is what is it that causes the stress for us as in our day-to-day life as in general practice. And you know, and I know I'm a GP primarily, but also I'm involved in medical politics at home. And I think the important thing about that is that GPs have got to step up and take control of their environment, and I think we advocate very strongly for that things like quality frameworks and measurement of quality and provision of research and all of that sort of stuff are the things that we cannot absolve our responsibility to our ministries of health and our ministers of health and our other people, because actually they get it wrong again and again and again. And guidelines are just that. They are guidance usually from specialists who don't understand primary care practice. And you know, as generalists, we are the specialists of community-based healthcare. And you know, I feel very passionate about the fact that as generalists, we should not be being told what to do by partialists who often do not understand what it is that we do in a general practice, which is mixing together the elderly, who no one does any research on, who have multimorbidity, and all of the guidelines are about diabetes care in 50 to 60 year olds, and COPD care in 50 to 70 year olds, and you know, congestive heart failure care in 50 to 70 year olds. There's not any guideline in the entire world about dealing with diabetes, COPD, and ischemic heart disease in a 90-year-old. There is not one, you know, and yet that is what we do, and you can't follow guidelines. In fact, if you do the wrong thing for the patient. So it's a matter of advocating within general practice so that we then take the beach. It is our beach. It is where we work. It is the area that we believe that we know what the science. Well, there's no science. We understand the interpretation of the science, and that way we then take back some of the stuff, because in fact, the minute you allow people to say, "Oh, if your glycated hemoglobin is not less than 8.5 on average, then you're a bad doctor," then that is, you know, somebody else cannot tell you what that is. Only we as a group of professionals can decide what we think that is. And it might be true in the under 60-year-olds, but in the 80 to 90-year-olds, it's fundamentally not true. And of course, you know, in New Zealand, we get measured on our immunisation rates and a bunch of other. We got 5 big things that we get measured on. And the immunisation rates, you're not allowed to note that people are conscientiously injected, having given all of the information that an active decline to do an immunisation is not an immunisation. So you've got to get 92%. or you fail. And so if you get 7, or 9% of your population saying that we don't want immunisation, then you fail. You can never achieve that. And our Minister of Health just says, work harder.
Is it still democracy down there, is it?
Can I just point out something, the terminology. Guidelines are something, information out there we can use. Standards are something maybe we decided we should use, right? And protocols are stuff we have to use, right? So really it's the protocols that are imposed on us that we're complaining about, actually, all right? There's protocols that you have to adhere to fulfill a payment.
But in our life, what happens is the guidelines then get interpreted by the ministry and the minister as being, well, this is what you should do, why aren't you doing it?
So it's the protocol. You can ignore the guidelines if you want. Sometimes we ignore national guidelines, international guidelines. That's the way.
International just as bad.
Yeah, it makes sense.
Do we have any contribution from the back here? Please. Go ahead.
I was just asking, do you have these kind of protocols in Denmark? Because I don't really recognize it from Sweden.
Okay, so what issues would you like to contribute?
What I do?
Yes.
I exercise. I always take coffee breaks in the morning and in the evening, always. I talk to my colleagues a lot in their rooms. I don't know. I feel satisfied right now.
I can contribute something. I'm a young GP, and for me, it gives me new energy to be in a network of like-minded people, which is why I'm active in the young GP movement in Denmark. And that gives me, even if I had a crappy day, which was way too busy, then I go back home and I look on Facebook, or I just go to a meeting, or I meet somebody that I know, because you have an incredible network, and then there's somebody who is like me, more or less in the same place in their educational level, and you can discuss the frustrating things, and you can hear the good stories, and it gives me new energy to go back the day after and start like on a fresh level. And there's another thing, that was actually a psychologist I met once, and she works alone, pretty much the same as if you're a solo practice doctor, and she had been asked many times, so are you not bored? You're stuck here all alone, all day. And her answer was, no, I'm not alone, because I have my patients. And each hour I meet another person and get a new story. And that's something that I've taken with me, because that's the essence of being a family doctor for me.
Yeah.
That it's the exceptional thing that I actually get to listen to all these different lives. And these people, they come and they tell me stuff that they would not tell anybody else.
Can you give us an example of a patient that made you happy?
Oh, there are many. I cannot think of like one particular patient right now. I have many that I remember. I feel thankful that they tell me their stories. Not just about the illness that they have, but also about their personal lives, or the tragic stuff, the happy stuff that happens, and they come back. Because that's also what happens when you're a family doctor. You see them again the week after, and you can follow the whole family.
So it's like reading a good book.
Yes, it is.
That's really good. It's like reading a good book. Tell me about laughing with patients.